I was originally diagnosed with scoliosis when I was a junior in high school. So I was 16, and we didn't know anything about it. We didn't know. They did the scoliosis checks in school, but that's all I knew. So once I was diagnosed, I was referred to a spine specialist, and he did x-rays, and I had a moderate curvature. The number that they gave was a 35-degree curve. They just said, we can do surgery, and that would correct it about 50%. We said no to surgery, and so he just recommended that I go to the chiropractor regularly. It helped with inflammation, but it was always temporary, and so I would end up back, right back where I started, and I did that for years. With my specific scoliosis, I've had a lot of physical limitations. I've not been able to be as active with my kids. It just hurts. And so I would say that's probably my main motivation, is to get my body back in shape so that I can be with my kids and so that I can be the mom that I aspire to be.
So scoliosis pain can be somewhat of a mystery when it comes to who actually experiences it and who doesn't experience it. Scoliosis in adult, especially when it progresses as an adult, has a high incidence of causing pain. In Alisha's case, knowing it's a primary lumbar curve, even a higher incidence of causing pain. What happens is when these adults, they progress slowly over the years, this progression is because of gravity, which can lead to compression of the spinal tissues, and the progression of this compression is what leads to pain. And the onset is typically mid to late 30s, around 40 years of age is when it starts to onset, and then it starts slowly progressing, where it just gets worse and worse and worse. For some people, it can start earlier. It just depends on the size of the curve. Lumbar curves would definitely have a higher incidence, like Alisha.
Dr. Tony's approach is, I am treating the scoliosis. We are doing therapy so that your spine will actually shift and straighten. And in watching a lot of the videos that you all have done it just gives me so much hope. You see people that come in with 35, 40-degree curves, and they're down to 10 or less.
One of the surprising factors in dealing with adult patients is they actually have a very good retention rate. They hold their reduction very well. And the main reason is because they're not progressing. They're not growing, they're not rapidly progressing. What's causing their progression is slow gravity. So if we can reduce the curve with intensive care, which we have a high success rate of doing that, for holding that reduction isn't actually that difficult. It actually can be done very easily with some maintenance at home, some home exercises at home. If they have a brace, wearing a brace, and for most adults, they're wearing the brace part-time at most. So with part-time bracing, corrective bracing, and home therapy, they can maintain their reductions and have long-standing reductions. The results aren't permanent, but they can be very long-lasting, is what I tell patients, as long as they are active in the maintenance program that we prescribe them afterwards.
The experience overall has been wonderful. The staff has been amazing, and they're so supportive. The machines here work muscles that you don't work on a regular basis. It loosens you up so that when Dr. Tony makes the adjustment on your body, that your body is relaxed and it's ready, like it's ready for movement. When I first came, my x-ray showed a 43-degree curve, and I got x-rays yesterday, and I've gone down to a 31, which is just mind-blowing, because 3 months ago, I didn't even know that was possible. I didn't even know that was an option. I've cried a lot since I've been here, not because I'm miserable or unhappy, but because I'm just thankful. When you're talking about moving spines, not many people are talking about that. So the information that he has and the people that he helped, it's really going to change the whole view of chiropractic care. I know that I will continue to have hope as I go home, because I have seen so much improvement since I've been here in myself and my spine. And also with that, be an example to my kids of how important it is to take care of your health. Mommy has to take care of herself, because I have to take care of you, babies.